Pandemic has had a huge impact on the lives and economies of every country. In the US, the response is known as the American Rescue Plan. But how do governments make sure that the plans help reach those who need it most? That's our next speaker's job. Our first speaker's job of the morning. He's the Chief Data and Equitable Delivery Officer on the White House American Rescue Plan team. He is joining us to talk about how data, design, and delivery are being used to inform the U.S. recovery. Please welcome to the Forward 50 stage, Dr. Clarence Wardell III.
Thank you. Good morning. Great to be with everyone. Thank you to the Forward 50 team for having me and allowing me a few minutes to speak with you today about the Biden administration's approach to equity and our commitment to delivering an equitable recovery, beginning with the implementation of the American Rescue Plan. As Rebecca mentioned, my name is Clarence Wardell, and I'm the Chief Data and Equitable Delivery Officer for the White House American Rescue Plan team and Senior Advisor for Policy Implementation and Delivery with the Domestic Policy Council. It's great to be with you here today, not only because of the great conversation we have ahead of us, but because of what this community represents. As Alistair mentioned, the last 19 months have been difficult in many ways, and while the effects of the pandemic have not been felt evenly, they have been felt by all of us. We have undoubtedly made great progress as a global community to try to get this under control. And at the same time, even amidst that progress, we are conscious of the work ahead of us to heal the wounds left by the last 19 months to so many of our communities and neighbors. The $1.9 trillion American Rescue Plan signed into law by President Biden on March 11th is a significant step toward healing those wounds and represents an opportunity like no other that I've seen in my lifetime. The promise of the rescue plan is not just to build back to where we were before, but as President Biden says, to build back better, to become more resilient. However, the promise of something is not always the same as the reality, as we know. In this case, the difference between policy on paper and an impact for real people in their day-to-day lives lives within the hard work of implementation. How we deliver in this moment and how we use this opportunity before us will have multi-generational effects. We know this because we've seen it before, and we're living it right now. Black, Latino, and Native Americans were more likely to be infected, hospitalized, or die from COVID-19 than their white counterparts in the U.S. The initial iteration of the Paycheck Protection Program disadvantaged minority-owned businesses, leading to inequitable access to capital at a time of critical need. Communities of color were both more likely to work in essential frontline roles with a higher risk of exposure and more likely to lose their jobs as the pandemic caused the economy to contract. In March 2021, 22% of Black and 20% of Hispanic renters could not pay their prior month's rent on time, an indication of potential future eviction. In contrast, only 9% of white renters said they could not. High poverty school districts and districts serving students mostly of color and lower achieving districts were more likely than their respective counterparts to indicate that daily attendance in the fall of 2020 was substantially lower than the previous year. These are just but a few examples of the inequities that both existed at the start of the pandemic and which were further exposed throughout. The actions that we take in this moment will determine whether the implementation of ARP contributes to reversing the widening disparities across socioeconomic outcomes or further entrenches and exacerbates those gaps. The Biden administration is committed to ensuring the former, but we can't do it without ensuring that equity and equitable delivery of ARP resources is operationalized as a central focus of the efforts. On day one of his administration, President Biden, through the executive order on advancing racial equity and support for underserved communities through the federal government, provided a framework and a charge for this work. So today, I just wanted to highlight some of the key pieces of that framework and underscore some of the administration's principles for delivering resources in a way that advances equity. Just to level set a bit, the executive order defines the term equity to mean consistent and systematic, fair, just, and impartial treatment of individuals who belong to underserved communities and that have been denied such treatment. And then defines underserved communities as referring to populations sharing a particular characteristic, as well as geographic communities that have been systematically denied a full opportunity to participate in aspects of economic, social, and civic life. So at its core, equity means centering those communities, not excluding others, but making sure you're addressing the needs of communities and individuals who have either willfully or unintentionally excluded previously. In that vein, as we look forward to maximizing this historic opportunity, I want to offer a framework for thinking about equitable delivery of programs and services and highlight some of the progress we've made to date and where we have more to do. So our guideposts as an administration that we look to when thinking about equitable delivery began with, first and foremost, designing for the hardest to reach and most in need, which means getting close to the problem from their perspective and understanding their challenges with accessing programs and services. In this vein, we think about awareness, accessibility, and allocation, and ask, are underserved populations aware of our programs or services? Can the most vulnerable access and use these programs or services without massive amounts of burden? And are we allocating and distributing resources for underserved communities in ways that are fair and equitable? The second guidepost is around holding ourselves accountable to equity through goal setting and measurement. These include setting clear equity goals around our programs and designing our systems to collect data to understand progress toward them, including allocation flows and who is actually accessing the resources, and where we can, collecting demographic and geographic and other information that would help us make those assessments. Third, and related to the previous guidepost of measuring progress against equity goals, is to build short cycles of feedback. So not only making sure that we're collecting the right data, but that we're doing it in ways that allow us to learn as quickly as possible and course correct. In particular, for new programs, of which the American Rescue Plan had many, it is even more consequential to understand how they're working. And I can't stress this enough. From our perspective, you have to make sure that feedback is coming from a variety of perspectives, with the most important being the impacted community and individuals. If we're not taking the time to understand what people need and want, and whether or not what we're offering is meeting those needs, then we're not delivering in an equitable manner. Lastly, I'll offer another variation of this theme of data collection as a core component of equitable delivery, and that is evidence building and investing in what works. I think this often gets overlooked in the equity conversation, but I can't stress enough, and I think it's one of the most important pieces here. Evaluation and evidence building have to be at the foundation of all that we do to ensure that we are actually delivering the outcomes that we originally intended, as well as to ensure that we're not actually doing more harm in some cases. And so we should be constantly evaluating and hopefully setting up some rigorous structures to examine outcomes and not just outputs. So for instance, if we're thinking about a rental assistance program, we're not just asking if we're getting dollars out the doors, but we're asking, are we keeping people in their homes over the long term? And what other supports are needed? And what other wraparound services are required to do that? The Biden administration has been hard at work across ARP's many transformational programs to bring these principles to life. And so I want to offer a couple of examples of the challenges we face and our approaches to addressing them. One example is the child tax credit expansion, one of the most transformational elements of ARP. The child tax credit was originally created in 1997 and through ARP was expanded to be fully refundable for the first time and advanceable on a monthly basis, in addition to increases in the size of the credit. So what this means practically is it was the promise of a check in the pocket of low-income to middle-class families on a monthly basis to help with bills, help with childcare, help with all the things that we know families struggle with and particularly struggle with during the course of the pandemic. And so the promise of these changes, by some early estimates, would bring significant reductions in child poverty rates this year. The implementation challenge was, how do we get this unprecedented monthly payment up and running in just 4 months while reaching as many families as possible, including those who were eligible and unenrolled? So you'd imagine we had also had 3 stimulus checks before the child tax credit. And so there were families who were eligible for those that we know had not claimed their stimulus checks. And so we knew that it would be a challenge to find those families and make sure that they were receiving the money that they were entitled to. And so our strategy was to make it simple and reliable for families and to launch a whole of government effort to sign up kids who might miss out on payments. So this included launching a one-stop shop for information on childtaxcredit.gov, available in English and Spanish, creating an update portal that makes it easy for families to change addresses and switch to direct deposit, automatically enrolling over 700,000 children based on their parents signing up for those stimulus checks that I had mentioned, and working with Code for America, who I know many of you know, to launch a mobile-friendly bilingual portal to reach nonviolence. We have also worked with mayors across a 16-city working group to promote best practices, including text messaging that connects people to trusted messengers in their communities and sign-up opportunities, and really pushing for those last-mile touch points to reach people, let them know what's available to them, and enroll them. And this also involved a broad effort to partner with advocacy groups like the Children's Defense Fund, United Way, and the Center for Community Change to understand what was working and what wasn't to reach families, and to constantly iterate and update our strategies. So these efforts have resulted in reliable monthly payments for families of over 60 million kids, including monthly same-day delivery of payments that began within 4 months of ARP passage, with close to 90% receiving direct deposits, families of 26.5 million low-income kids receiving the full child tax credit, and over 3 million kids, by estimates, kept out of poverty each month through the implementation and delivery of this policy. So like the CTC expansion, another program that folks may be familiar with was the Emergency Rental Assistance Program, which has been a critical resource for individuals and families facing housing instability and the threat of eviction. In this instance, with over $46 billion available across 400 state and local grantees to prevent evictions, we faced a significant challenge in ramping up support with no prior national infrastructure for eviction prevention. So as we faced the expiration of the national eviction moratorium, we undertook an all-out push to help stand up programs and improve funding distribution, including providing as much flexibility as possible to state and local grantees for determining eligibility and enrolling individuals. Alongside this work, we pushed for more frequent data collection on a monthly basis to understand which communities were most vulnerable and get a better sense of how funding dissemination was going and where there might be bottlenecks. This also included work with the U.S. Digital Service and the Consumer Financial Protection Bureau to launch a rental assistance finder, which has been used by a wide range of external partners and help push awareness about programs and available funding to individuals in the places where they're at. So one other program that I just want to talk about a little bit that goes a little bit under the radar from an implementation ARP perspective, but is absolutely critical tool in addressing health and nutrition disparities is a special supplemental nutrition program for women, infants, and children, which folks
it's just frozen.
Hey, we seem to be having some issues with Clarence's audio, which we're going to figure out. Apologize for that. As you can probably tell from the fancy background behind Clarence, he's calling us directly from, I think, the West Wing at the moment. But what's amazing is that so many of these incentives that we're sending out are often things that we have to find out how they're being used to make better decisions. Because in many ways, when there are these well-intentioned programs, if we don't look at the right metrics, we have a problem. This came up in a couple of talks yesterday about food stamps and subsidies, that the best metric to track is often things like who couldn't claim the food stamp that should have been able to claim it. Because if you have a system like that, where you're able to say who couldn't, then all the other metrics fall out of that. So simply asking the right piece of data will sort of give you a thread that you can pull on. I'll tell you that the team backstage is trying to get Clarence back with us. His role was something that when the administration put in many of their Build Back Better plans, they wanted to be sure there was an equitable balance for those things. And of course, we've seen the same problem in countries around the world. Whenever there's a subsidy or some system like this, it's fairly easy to find loopholes and exploit them, particularly when systems are put together in a hurry. We certainly had rapid deployment of benefits in Canada with CERB, and for the most part, those went well, but inevitably there was criticism months later when people said, hey, is this information going to, did I get a donation that I shouldn't have received, and am I going to have to pay taxes on it, and so on. So there is this, we've often complained about the speed of government innovation. But I think we have to recognize there's a trade-off that when we do things very quickly, we don't anticipate the loopholes, and then people like Clarence's role, who are able to step in and ensure that equity, are a good bellwether to balance the alacrity and speed and lean sort of iteration that we'd like to see in government with the unfortunate consequences that the government programs are often exploited. And so that's one of the reasons why he's there. My team is telling me that Clarence is back. So Alex, if you...
Hello, can you all hear me? Apologies for that.
Better. You may want to back up a little bit. I'm sorry we lost you there. I've been filling in the time with less interesting commentary on the challenges of moving quickly and how that often results in people exploiting loopholes. But why don't you pick it back up?
Yes, apologies for that. The Wi-Fi here at the White House is not always the greatest. So I'll try to pick back up where I was at. And so I think, you know, I was just talking about the Emergency Rental Assistance Program. And so one of the programs that I wanted to mention before wrapping is WIC. And so this is a special supplemental nutrition program for women, infants, and children, which received $390 million from
I think so.
Yeah, it looks like we're having, I don't know if it's a... Oh, he's back.
I think he's back.
Available to reduce stark disparities in maternal and child health outcomes, but is chronically undersubscribed, and many who are eligible aren't aware of the program. Over the past several months, U.S. Department of Agriculture's Food and Nutrition Service has held over 30 listening sessions with more than 200 WIC stakeholders. Overwhelmingly, they heard about the need to create broad partnerships to improve equity and program access, and also heard about support for investments in online technology to improve the program experience for today's participants. Moving forward, they are pursuing 4 strategies to make improvements, which all speak to equity. And so making sure that the eligible families know that they're eligible for these benefits. And so moving beyond the 57% of eligible families who are currently enrolled to try to move that number to a much higher percentage. Second, supporting the development and implementation of business practices and technologies to improve the enrollment experience. Then third, also thinking about how we're developing options for online food purchasing and better electronic use of the benefit at places like farmers markets. And then fourth, building a broad ecosystem of partners and stakeholders at the local level to, again, make sure that we're reaching folks at the last mile of enrollment and awareness about what this program can do for them. So these are just a few examples of how we've been working to embed our principles of equitable delivery into program implementation. And so while I contend that we're off to a strong start, I also don't want to be blind to the challenges that remain ahead. We've had instances of massive fraud and identity theft across some of these pandemic programs, and how we deal with that in an equitable manner will be a challenge. This work takes constant engagement, partnership, and evaluation of whether what we're doing is working, and there are trade-offs to be made along the way that aren't always easy decisions to make. So before I go, I'll leave you with this. I've talked primarily about our implementation of the American Rescue Plan, but whatever your programs are, actually making them work for everyone is the equity work. And so this means that we need to center those who are most in need and to make sure we are reaching them and that they're able to take advantage of the resources. This is a moment, like I said, unlike any other that I've ever been in, where we actually have the resources to do more than we have ever imagined, and to build things that last with equity at the center. And so I look forward to continuing in close partnership, with all of you, those of you who I've met, I know are out there, and those of you who I haven't. And I can't just stress that this work is extremely critical and will set the course of how we not only respond from this, but how we deal with future challenges, not just as America, but as a global society moving forward. So thank you for that. And apologies again for the Wi-Fi.
Oh, don't apologize. I think we got the best quote of the day. The Wi-Fi isn't great. Although, as Alex Howard, who I'm sure you know, was saying in chat, just the fact that there's Wi-Fi in the White House must represent an incredible, I can't imagine how much security had to go into getting that to work. So just the fact that it's there. Clarence, thank you so much for that. And I guess the work is, there is this tension. Like people say government should move fast, but when it moves fast, it leaves loopholes. And there's this idea that the slow legislative process allows us to be more thoughtful and identify how it might be misappropriated. And I guess your role is sort of a way to find a compromise between doing things quickly and responsively while still having some of the deliberation to make sure that the intent of the law is what's being seen rather than just sort of it being exploited by people who are looking for a loophole.
Yeah, and I'll just say, the president wanted to balance the scales here. He was instrumental in implementing the Recovery Act during the Obama administration. And so he's quite familiar with, and I think as you allude to, we have a vast infrastructure around waste, fraud, and abuse for all of these programs. IG, Inspector General infrastructure, all types of programs that and checks that these programs need to go through before going out to try to prevent both mismanagement of funds and access with folks who shouldn't have access. This role and really his intentions on the front end were to make sure that we're balancing equity with that where we can. And it's it's the first time certainly that I'm aware of that it has been so explicitly named as part of a major legislative initiative. And so, we're learning as we go and trying to build around those principles that I outlined.
Janet Haven, who was on yesterday, was mentioning that in many cases, the data collection, particularly in marginalized groups, can be more difficult. Is there anything you've had to change to make sure that you have equitable data collection for groups where they may be mistrustful or unwilling to share information like that?
Huge challenge. One of the other things that I neglected to mention as part of the day one executive order, the president established an equitable data working group, which is an interagency effort in part to look at these issues. So some of the issues are just kind of brass tacks. Can we do better data linkage across different agencies? where can we disaggregate around data that we have. But it is a critical question that you're asking, particularly as we think about that balance for, we want folks to sign up for these benefits. We want folks to enroll, but there's often questions, not just about asking the question that becomes more burdensome, but we have to understand, and I don't think we have enough kind of insight onto this yet. The more questions you ask, the more likely someone, or in some cases, the more likely someone is to, and I think this was the crux of your question, to be mistrustful and to not actually access that benefit that's available to them, precisely because we're asking for some of these data questions, right? The flip side, we're asking the data questions, so we want to know, is this program reaching folks, right? So there's that tension. There's not an easy answer to it, but I think part of that gets back to this evaluation piece. And experimentation and trying to understand what works and what doesn't, both in forms and data collection, but also broadly for implementation of the programs.
Awesome. Yeah. And this trust in government, which is really the core of all of this, or trust in public institutions, is something that keeps coming up throughout the conference. Thank you so much. I know you must be busy. Really appreciate joining us, giving us the best soundbite of the day about White House Wi-Fi, and keep up the great work.
All right. Thank you. Appreciate it. And sorry again for the technical difficulties.